I'm Dr. Edgardo Cortez. I'm a surgical oncologist by profession, and I'm now the president and the CEO of the St. Luke's Healthcare System. So far, we have two hospitals, one extension clinic, and we have about 32 satellite hospitals. And soon we will build our third hospital somewhere in the southern part of the Philippines.
So you clearly have a great overview of healthcare in the Philippines,
Yeah.
with all that sort of wealth of hospital organisations. So what are the current challenges that you think the healthcare industry is facing in the Philippines in particular?
Well, I believe based on the mega trends in the world, which definitely also applies to our country, is that the increasing longevity of patients because of excellent care, better nutrition, and support systems will also pose a big problem eventually, and that would be the rise of chronic diseases. As people age, one time or another in their whole lifetime, they will develop a chronic disease. And a chronic disease may be in the form of diabetes mellitus, cardiovascular disease, cancer, and the like. And therefore, the challenge of many hospitals, I think all over the world, is common, is how to take care best of chronic diseases. And I think very soon, hospitals will be judged on how well they take care of chronic diseases, and that would be the parameter to judge whether a hospital is really adapting to the changing times in the healthcare industry too.
And so are there any projects either in your hospital group or across the Philippines that you're aware of that are already trying to tackle that problem of a growing and aging population?
I think there is no formal project in government yet, but many hospitals now realize that we have to subspecialize in those fields like cancer, like endocrinology, pulmonology, gastroenterology, and the like. And there is now an upsurge in terms of people being trained outside of the country and coming back to be able to be the experts along these fields. And that is not only true with us, but I guess in many hospitals also in the Philippines. Aside from that, based on our experience, we are now beefing up all the necessary equipment, the expertise to deal with this kind of diseases, including research, from basic research, as we call from the bench to the bedside, translational researches, in terms of discovering novel treatment modalities to be applied to the bedside for better care of the patients, especially with this kind of diseases. And we've done that too, together with biotechnological research. No? And that is as far as our hospital system is concerned.
And do you have some of those sort of academic sort of facilities and strengths within your hospital group, or do you opt for collaborations with, say, universities?
Well, just to inform the listeners that we are the first JCI accredited academic medical center in our country. And it means that we have actually a medical school which has been rated number one last year by the Philippine Regulation Commission. We also have a very strong research facility. We're number one in healthcare research with the most number of trials going on in a year. In fact, we even have about 170 international clinical trials going on at any given time. And then we have a wide array of training facilities, not just for doctors, but also for non-medical personnel. And so we feel that those are the major components of an academic medical center, but it doesn't prevent us from also collaborating with other academic centers. There are a lot of hospitals or even universities trying to collaborate with us for rotating their students or performing research projects together with us. And this is not just local organizations, but also foreign organizations as well.
So you've clearly got a big focus on improving your people and
Mm.
sort of the people talent side of your presentation. Are there any focuses on technological advancements that are also a priority for the Philippines more broadly or for your hospitals specifically?
Yes, in terms of our research, we have actually gone into genomics, um, proteomics, um, deriving medicines from plants, research in terms of stem cells, and more recently, in terms of biotechnology, we are now field testing a dengue kit. And very soon it will be out in the market. This kit will actually determine whether a patient has dengue or not with just a drop of blood. So this is what we call point of care testing. We've also recently come up with the kind of test, which is the BRAF 600 test for gene mutation for thyroid cancer, to determine whether a thyroid cancer that is even diagnosed early would be very aggressive based on their genetic composition or genetic characteristics. So this test is also available elsewhere, I think, but our test seems to be more accurate because it has been adapted to the Philippine setting, and therefore I think it will be out in the market by next year.
It's very exciting.
Mm-hmm.
Yourselves and the Philippines is making progress in that sort of diagnostic testing.
Mm.
Certainly, America and Europe are definitely forging forwards with
Mm.
precision and personalised medicine. Do you think that's a trend which is broadly being taken up by the Asia market, or do you think it's that the sort of genetics of medicine is going to take slightly longer in the Asian market as a whole?
Oh, I think the Asian market now is very active in research, no, and very active in collaboration with European and Western countries. Like, for instance, we have a collaboration with different universities. We have Tohoku University in Japan, Kobe University. We are a member, one of the newest members of the um, Mayo Clinic Care Network. We also collaborate with Harvard, with Cleveland Clinic, and so many other universities. And this, will augur well for the fulfillment of our vision to be an internationally recognized academic medical center. And I believe not just through research or sharing what we know, but if other established academic centers would recognize us, like these people that these institutions which I mentioned, then actually it speaks well that we are now starting to gain international recognition and respect.
So, with some of those projects in mind, why was it that you came to HMA this year? What was it that you were hoping to get out of the talks and the presentations and the networking here this year?
Well, before I've gotten invitations to attend HMA, and it seems that it always coincides with some very important activities in the organization. But since it's been held here, I have no reason not to attend. And precisely why I'm here is really to be able to collaborate with our Asian neighbors, especially those in the medical field, in the management field, compare and benchmark what we do, try to learn from them because indeed they've also a wealth of experience, and therefore we believe that in the Asian setting there is some unique characteristic of the population that we serve, and therefore unique problems that can occur that will need to be solved in a unique way. So that would be my major aim. And of course, a little is to share what we have done and what we know so that others may also learn from that.
And so, on that note, could you perhaps give us a very quick snapshot of the presentation that you've given here at HMA?
This was in the JCI CEO Forum, which just finished about 30 minutes ago. And what we shared was our plan of St. Luke's on how to cope with surges in patients and disasters. And we have shown them the different areas where we mitigate these disasters We also show them how we prepare for such an eventuality. And then when it happens, then what do we do? And lastly, but also very important, is after the incident, what have we learned from that and how to improve the process once again? So this is a cycle that we presented earlier, and this also involved internal and external communication, collaboration with local authorities, and so many other things that I believe that could be adopted in all hospitals, particularly in our country and also in our neighboring countries too.
And so clearly there, being one of the leaders in the Philippines and leading that sort of session, as well as all the projects that you've already mentioned, have you put yourselves forward for the awards ceremony in 2017?
Well, we always send our entries, and fortunately, we've been very fortunate in the last few years to be winning awards. But beside the awards, I think it is really more of trying to share what we know. As an academic medical center, we do not only train our people to be able to be experts, but we train them not just to be able to be experts, but also to share and impart knowledge to others. And this actually is in line with our vision, and we simply put it into action. And we believe that this is the way that we can learn from each other. If everybody will try to share best practices, then I think it would be easier to improve healthcare in general. And that's what we do.
And as part of HMA 2017, we are running a site tour to one of your hospitals in St.
Yeah.
For the people that are attending that, what's the one thing that you would hope that they would take away from that experience?
I think I'll go first to the physical plant. We're proud of it. And many people will say it doesn't seem like a hospital because exactly we designed this as such, because we want a healing environment. Secondly, we have been known for advanced technology and expertise of the people. And thirdly, we are also known for patient safety. And therefore, people who come to us to access our service, they just don't want to get well. They want to be safe likewise. And lastly, we boast of our great patient experience, which is really the sum total of the expectation of any patient in accessing services of any hospital. So those are the four things that we want people to appreciate. But at the back end, we do training and research to improve our clinical outcomes or success rates, which, by the way, we benchmark with the best in the world. In many cases, we are at par. In some cases, we are behind. At least we know. But in a few instances, we're even ahead. And that will be the impetus for us to continuously improve.
So then, final question, in relation to visiting hospitals, and certainly there, as you say, so interestingly, benchmarking yourself against the best in the world. If you were able to go on a site tour to any hospital in the world, where would you go and why?
Well, I've gone to many places in the world to check out what they're doing. But one of I believe my favorite places to go would be the Mayo Clinic. Because the Mayo Clinic has actually the same mission that we have. We are also aligned in terms of our pursuit for academic excellence. And they are also a destination hospital, which we believe we are too. We're not into expanding, buying hospitals, putting up clinics, but we are there for a unique purpose. We are a non-stock, non-profit institution, and we want to be a destination place where people can seek maybe a higher level of care just in case they need to, and hopefully also be able to enjoy their stay as well as get the best outcomes that they can.
That's been fascinating, so thank you so much for your time.
Thank you very much.